Good morning and welcome to STEM's Health Podcast. I'm here with Dr. Choxi. My name is Dr. Jared Mait. We are the co-founders of STEM's Health based here in Miami Beach, Florida. And today we're going to kind of talk more about our company, more about what we do, how we founded STEM's Health, and a lot of the procedures that we work on in order to kind of bring our patients to another level of pain-free longevity and overall wellness. So I'm excited. I've been training in medicine for almost 2 decades now, working really hard to bring, the best treatments to my patients. And Dr. Choxi and I met probably around 15 years ago?
Oh man, 2013.
Yeah,
2013. Yeah, it's been a
13
long
years
time,
ago.
but it's been great. Slowly just building together and trying to get the best medical services, whatever we can offer for our patients. I'm excited to be here. It's been talking about this for what, 2, 3 years at least, that we should do a podcast, And, luckily our team and Rachel pushed us to get here today. So excited for this and future ones.
Absolutely. So, today I think we're going to maybe cover a lot of topics. Dr. Choxi's pretty much the master of these. He's, flown around the country. He treats patients from around the world. You know, you know so much about the science. Obviously, we integrate it well in our practice, and you teach me a lot about what's going on in the world of stem cells and, different types of treatments. I mean, you've been doing, how many procedures have you done, would you say?
Yeah, I jokingly tell people I stopped counting after 20,000. It's been a lot. It's what I do every day, just treating spine, joints, traditional pain medicine with steroids, ablations. But the past, what is it now, 3, 4 years, really diving into regenerative medicine. So, what can we offer patients that breaks the barrier of traditional medicine, allows us to help restore function, keep people healthy, keep people off the operating table. Um, and often keep them off prescription medications if possible. It's a very exciting time for medicine. I think there's a lot of paradigm shifts coming, and I think that's where you and I and our practice kind of integrate very well together. Is that we're able to offer the regenerative products like stem cells, PRP, exosomes, but then also that integrative functional medicine component where we look at the patient as a whole. We optimize them before procedures, after procedures, to ensure we maintain results for them long term. It's easy to inject someone and hope they do well, but it's really that hand holding and taking care of them for 6 weeks, 3 months, 1 year down the road to ensure that they have maximal results.
So it's never just a one and done type of procedure.
No, I mean, our patients are never one and done, right? We want to see their journey through many years and keep them healthy for the long term. And I think both of us really pride ourselves on that communication and relationship with our patients and staying in touch with them and just, building that bond to keep them moving.
Absolutely. And what would you say the number of patients that you have that come back for a second procedure? Not because the first one didn't go great, but more because they recognize how beneficial it was for the first, and now they're saying, "Hey, maybe my knee or maybe my."
Yeah, I mean, I'd say the greatest compliment I get is a referral, of a patient telling their family, their wife, or their son, or their father-in-law to come see me because they had such great results. Most patients of ours, they don't come back often. Maybe they come back every year or 2 years for a maintenance of their procedure. Hopefully, start to feel a little bit of pain coming back, or you know, they got better and now they want to stay active and they're playing more paddle, they're playing more tennis, they're playing more golf, and other parts of their body start acting up. So they do come back, but it's not every month they're there to see me.
Yeah, I mean, like, on my own personal experience, I had a knee injury, and I love telling the story because, I'm not just the founder, I'm also, a patient. And Dr.
The worst
Choxi
patient.
did
No, I'm
did
just
an
kidding.
ultrasound on me and saw that I had a MCL tear. You remember,
Yeah, of
probably
course.
about a year and 3 months ago, and I'm pretty active, in my morning exercise routine, and pretty aggressive with, how I use my body. And I didn't know if I needed surgery or if I should go see an orthopedic surgeon. And you injected me with exosomes directly into my MCL. And I mean, I was having numbness in my toes. I had inability to pretty much squat. And now, I mean, you guys didn't see before I got here, but I actually took one giant leap from the ground floor to the third floor of the studio, and my knee feels great.
Superhuman.
Yeah, for sure. So, can you tell me maybe why you chose exosomes for me, and about maybe like the chemistry or how exosomes work?
Yeah, sure. So, I think regenerative medicine in general can be confusing for a lot of patients. There's a lot of options out there, right? We have PRP, stem cells, which have different sort of ways to obtain stem cells, and then exosomes. Exosomes are sort of a derivative of stem cells. So for a long time, exosomes, we thought they were sort of the byproduct or trash of stem cell production.
Mm,
And over time, they started researching the exosomes more and more, and realized that these were such powerful tools for cell to cell signaling or communication and also regeneration. And they carry a very unique sort of molecular component called microRNA. And microRNA is it's extremely responsible for protein synthesis, which is important for tissue growth, for reducing inflammation. Um, and the reason they're unique is that the exosomes are an acellular product, meaning
mm.
there's no DNA, no genetic transfer, things like that. So a very robust product. It's now more in favor in combination with stem cell therapies. But for someone like you who had an MCL tear that was just, wasn't a major tear or a major issue, exosomes I thought were the most potent option for you at that time for anti-inflammation and just helping to improve sort of your stability of that
Yeah, and I
structure.
don't know if you did it because 'cause you're a good friend of mine, but, like, you followed up with me that next day, and then a week later,
We
you kinda
talk every
sent me
day,
a
but
text. Yeah, of course, but I kind of felt like that was the patient experience where
correct.
you didn't just treat a patient and you left it to the team to follow up. You're like, "How's your knee? How's it feeling?" And a week later, a couple weeks later, you kept checking in. I feel like that's your temperament, like, your personality is to
Yeah,
care.
absolutely. I mean, it's my OCD. So when I did your procedure, it's very OCD and everything's set
Sterile.
up, sterile,
Yeah.
very precise. But then also that aftercare, yeah, I love reaching out to patients, see how they're doing. And a lot of it is managing expectations and making sure patients understand this is going to take time to get better. So communication is very important, right? And obviously you're the same way with your patients, but STEMs really want to pride ourselves in making sure we're there for the patient. And it's, again, not a one and done injection.
Sure. And I mean, like in retrospect, like had I not done that procedure, I don't know what kind of pain I'd be living with now. And, I have a 1.5-year old. I have a new one coming in the next month. And like, I don't want to be an old dad that has knee
Of
pain and
course.
back pain and shoulder
And
pain
you're
and
so
whatever the
active.
pain
You
is.
work out, jujitsu, everything. You want to stay moving and stay flexible.
Yeah. And I don't want to have to go to surgery. I don't want to have to deal with the
Well, you were
complications and the
smart. I mean,
rehab.
for everyone listening, I mean, Jared wasn't immediately on board with the injection. As a physician, you had some hesitation to do it, but obviously we had thorough conversations. It was the right thing to do, but you did the smart thing. You didn't let it get worse, right? You
Yeah.
stayed ahead of it. Because once you have an injury and there's inflammation, suddenly those things can progress to get, more injury, more damage, and then we're fighting a bigger battle to get you better.
Yeah, I mean, I think it's really interesting because, like, you and I went to undergrad at top institutions, then we went to medical school at top institutions, then we went to residency. You did a fellowship in interventional pain management, and we learned so much, right? We're learning about how it's been done, the history of it, what treatments are FDA approved, which pretty much insurance covers, how to take the patient on a journey through things. And then you come to a point where we're starting to learn new things that are coming through the wire that were never taught to us in the past. But you and I are kind of innovative doctors. We see a way of doing things that are much different than perhaps what has happened, but we're leading the path forward. I mean, we're not
Right.
creating the technology, but we're certainly saying there must be a better way. And we're embracing those things, those products, those treatments, those procedures that says, this is the future of medicine. I mean, this, I could have gone to an orthopedic surgeon and potentially waited for surgery or had surgery, but like that's not the future of non-invasive procedures. I mean, what gave you the confidence to say, okay, I trained in, residency as a anesthesiologist. I was a pain management double board certified physician. I'm doing spine injections using FDA approved methods and products. And now I feel comfortable enough to inject a person's spine, cervical spine, lumbar, thoracic, whatever the level is, with a product that's not FDA approved, but I'm willing to stake my career and my license and my livelihood on using this type of product. What gave you the confidence to say, yes, I feel so confident because I know the labs, I know the procedure, I know the reason. Can you walk me through your mental journey?
Yeah, it's a great question. I mean, the short answer is just a lot of due diligence, right? It took me over a year and a half to feel comfortable doing this. And a lot of it was just doing a lot of my own research, just diving in head first to really understand the field.
Mm,
When we started this company and I started doing these procedures, this was not even on the radar in the United States. So a lot of it was building relationships and mentorships with physicians who are doing these procedures internationally,
mm,
where there was a lot more power behind them. There's a lot more research internationally in Central South America, the Caribbean, Europe, Asia. I don't know if you remember, but we used to take calls with physicians in Germany, physicians in Japan to really learn as much as we could, which I think is important, because you said it, we've studied so much, but studying never ends, right? And this is such a new field of medicine that we had to keep educating ourselves. Um, I read a ton. I read a ton of literature, scientific articles, textbooks, whatever I could get my hands on, and then even traveled internationally to shadow and watch other physicians and other PhDs to really learn about the products as much as I could. And then I finally, started gaining the confidence, started applying it in my own clinical practice, and started slow, platelet-rich plasma, PRP, bone marrow aspirates for, body's own stem cells or mesenchymal stem cells. And then as I gained more confidence and started meeting more people and people I trusted in the field, it just naturally, went to the next levels of being able to offer these sort of next generation products that we have now.
So let's talk about next generation products because it seems like the future's already here with stem cells, something that's been talked about for so long. I know when I went into medical school, I shadowed a local physician here, Dr. Hare, when he did mesenchymal
That's
stem
right.
cell
Yeah.
injections into the myocardium probably 15, 17 years ago. And now we've gotten past just mesenchymal stem cells from umbilical cord tissue. And now we're at the point of the future's future where we have the subset of stem cells called Dezawa MuseCells. Can you kind of walk us through why you're using these now, why they're so important, and how pretty much they work, and why they're probably the godfather of all stem cells?
Yes, I mean, so like we mentioned, so there's many different classes of stem cells, and the one of the most prominent that's been used for years now is mesenchymal stem cells. And if you took 100 mesenchymal stem cells and you looked at them under a microscope, naturally 5 or 6 of these would be Desawa Muse cells. And so what does MUSE stand for? MUSE. MUSE is multi-differentiated stress endured. And that sounds like a very scientific sort of word or combination of words, but those are very important keywords as to what separates these Dezawa Mu cells from our traditional mesenchymal cells. So multi-differentiated, meaning these cells are able to differentiate into multiple different tissue types. So bone, cartilage, blood vessels, brain cells, heart cells. And then the second part of that is stress endured. These are sort of the Navy SEALs of stem cells. They're extremely resilient. They have ability to directly home to areas of injury in the body or areas of inflammation, and they're stress endured, meaning in areas of high acidity, high temperature, high injury, they are resilient and they thrive in those conditions. Whereas, traditional stem cells, sometimes, they're not as strong and don't have that sort of potency to last for a long time in the body.
Now, you said home to a particular area. Can you explain what that means? Like the body is really intelligent. We learn that through immunology and different, classes in med school. But like what makes a cell know where to go? Like obviously it can go everywhere and then maybe it's diluted. The concentration just goes, you gave a little and it went everywhere, so maybe it doesn't go to the right place. Can you talk why these Desawa mu cells go to the right place?
Yeah, so Desawa MuseCells, this research has been ongoing for decades, right? Dr. Marie Desawa found that the body emits a special sort of protein or signal
Mm.
to tell the body that there's injury, that there's inflammation, that there's stress. And this is called sphingosine 1 phosphate, S1P. The Muse cells that was discovered have a special receptor on them for this S1P substrate. So naturally, when we put them in the body, these Muse cells, through that receptor, are able to directly target areas of inflammation or inflammatory response. So rather than just kind of go through the whole body and not know where they're going, just target everything, strategically they're able to go to areas of injury, areas of inflammation, and sort of seed themselves there to give their effect. So it's an extremely unique quality of Desawa Mu cells specifically.
And I'm sure, I know the answer to this, but maybe people who are watching, you know, are there any specific lab tests that you can objectively look at and say, we gave you the MuseCell IV infusion or injection, and your inflammatory markers have come down, not just locally, but systemically?
Yeah, I mean, there's significant biomarkers that we track, pre and post procedure, and I'll let you kind of dive into this more because you do a lot of the longevity and integrative medicine. But we can look at CRP, other stress reactive proteins. We can look at just pretty much every lab value, kind of see adjustments that kind of dial back. What in your experience, like, obviously you've been treating patients, like what stress markers or biomarkers do you see having good effect?
Yeah, I mean, so certainly, we're going to look at things like CRP as an non-specific inflammatory marker, things like ESR, the erythrocyte sedimentation rate, and then there's other more non-specific markers like IL-1, IL-6, IL-10, TNF alpha, looking at what actual inflammation is present in the body and whether or not giving a person an IV infusion of stem cells or MuSe cells more specifically can lower those particular markers. Because as we know, the inflammation is where the damage is either happened or happening, whether it's a vascular inflammation or neuroinflammation or wherever that process may be happening, especially for autoimmune diseases, whether thyroid destruction or different part of the body. So, the goal isn't to crush all inflammation because I think that there's an understanding that naturally these things should have a homeostasis and an equilibrium in the body. But it's when that inflammation is too high, whether through constant injury and repeat injury or mechanisms through food ingestion that's, raising inflammatory markers in the body or stress or, whatever it is, stress being pretty much like a quoted word because stress can come from diet, it can come from chemicals that we're
Lack of sleep.
inhaling, lack of sleep. It can come from mold. It can come from infection. It can come from autoimmune. So the word stress is kind of like a misnomer that it's just, oh my God, I'm so stressed in my life. My boss is coming down on me. My
All
wife
the
is
time.
coming down on me. My kids are crying. But it's not just mental stress. Of course, that's one of them. But the stress is how much stress your body can endure before that. In the functional medicine community, we use the word allostatic load. Before that, the load breaks the camel's back. It's not that you just got sick and now you can't recover. It's you were at a point of sickness and illness in your body that this recent viral infection put you over the edge. And maybe it was too much inflammation, or maybe it was a overuse of certain types of cofactors in your system that now has been so depleted and you need a full workup. Not only do you need rest, but you need a full workup looking at lab values, looking at perhaps physical exam findings within the heart, within the belly and stuff like that to see what actually is going on.
Yeah, there's a couple of things you kind of mentioned there that is good for us to kind of point out too. One is the mind body connection, right? So like a mental stress can evoke physical stress too. And so it's hard to differentiate the two sometimes. And obviously most of the time it's a combination of the two for most people. But one real thing, key thing you mentioned was the balance in our body, right? The body's ability to heal versus the inflammation that sometimes outweighs the body's own natural ability. And with regenerative medicine, sometimes it gets lost, but we're just giving the body what it needs to heal on its own, right? These are natural products. These are already occurring in the body. We're just kind of concentrating them and giving them back at a high level. Um, and as we age, our body's ability to heal kind of dials back. We have more inflammation, we have more stress, whether it's mental, physical.
Mm,
And so really these Dezawa MuseCells and regenerative medicine products are just trying to boost the body's ability to heal and put that balance back into proper alignment. One key word and sort of what we hear a lot about now is inflammaging. I'm
mm.
sure you've run into this. And what are your thoughts sort of on inflammaging?
Yeah, I mean, I think aging is a natural circumstance of living. I think that we see it across the biology system. It's not just a human condition. It's not because we're just getting sick or we're just, exposed to chemicals or what have you not. I think it's a natural biological process. We see it with a tree, with a flower, with a bird. But naturally, what can we do in order to reduce the premature aging in our body? And, that's what we do a lot from like the regenerative medicine side, not so much using stem cells, exosomes, and things in our clinic, but also, using functional labs, using, certain types of treatments in order to reduce the stress that the body's undergoing for premature aging and toxicity of the cells. So, one being our intracellular antioxidant capacity, right? Why is a cell undergoing such stress? Not just there's inflammation in my skin or I have brain fog, but really all of this is a subjective complaint that underneath it all, there's a cell that's undergoing an incredible amount of stress that's trying its best to upregulate or downregulate something. But the body's an intelligent system, trillions of reactions happening simultaneously. How do we give back what it needs to keep going? I mean, the heart doesn't take a rest. We learned this in medical
Correct.
school.
Yeah.
The heart's pretty much one of the only organs that doesn't stop moving, right? Throughout the day, throughout the night.
Hopefully.
It's not right. It's not going to sleep. And so obviously it has a lot of capacity to keep going. I mean, it's the greatest marathon runner we know on the planet. But, when looking at the body, back to the point of the cell, what stress is being imposed upon a cell, both from the outside as well as the inside of the cell, in order to expedite the aging process, or even worse, causing damage to the natural process of the cell behaving how it should. Smart cells are able to cut out mismatched DNA repair mechanisms. We learned it in medical school or post medical school with the process of the cell looking at the checkpoints. Does this
Of course.
DNA have the ability to keep going through replication processes? Does it have the right end caps? Does it have the right proteins on top of it in order for it to keep going and growing and turn into what it needs to be, whether a self-surface receptor, whether a protein, what have you not? And so all of the stress that's going on inside of the cell can cause damage. And when we talk about telomeres and the ability for them to stay, these little end caps on them, and that's part of the process of aging where those cells can die if those telomeres get too short and the cell goes through apoptosis and autophagy and perhaps it gets recycled. But nevertheless, we have intracellular mechanisms that are happening, whether we need cofactors from iron or copper or zinc or just something basic like sodium and potassium and chloride, or things like NAD, which is a huge point we're not going to probably go into too much depth,
Right.
or things like glutathione that are used intracellularly for an antioxidant capacity, or another big one, coenzyme Q10. That's been used a lot because the stress, and I'm not anti-statin. I'm not like a doctor who doesn't believe in statins. I think they've saved a lot of lives. I also think that they're overprescribed to patients perhaps that don't need it. And I know that we do a lot of testing to look at CT angios, to look at heart flow analysis and AI studies looking at how the heart is actually getting blood supply by looking at objectively what's going on. But if a patient needs a mechanism to lower their cholesterol because they have atherosclerosis, their calcium score is high, they've got ischemia, what have you not, and we put them on a statin, there needs to be a corresponding understanding that the coenzyme Q10, CoQ10 levels are dropping so much to cause so much stress on the muscles, on the brain, on the heart, on the
Yeah, I
liver.
think kind of what you're getting to is, that medicine's changing a lot, right? Traditional medicine is you go see your doctor, you get a medication, you come back in 3 to 6 months, and hopefully things are better. But obviously, everything you just mentioned, kind of, to people listening, and to me, it's, how much thought is going into the treatment of a single patient. And that we're looking at all these different biomarkers, we're putting it all together to really optimize the patient before just prescribing a medication and sending them out the door, which I think is very important. And, I think a lot of people are now looking for that in medicine too, not just I don't want to just take this medication for the rest of my life. How do I make myself better so I can stay away from medications? And it's really that optimization that I think what you're getting to with those points, right?
No, absolutely. And I also think it comes down to like we post COVID, we became the era of retail medicine where you can go online and find an influencer who may have found another influencer who taught them about the way to influence people to buy a peptide or to buy a supplement or to get a lab test. And, while I think that information is critical because we learned from information, but it's not just having, well, this peptide will cure everything. It's not so simple. We didn't go to medical school for 4 years and residency and training and post fellowship to be able to say, well, we just need to have one tool in our toolbox and that's going to cure everything. Food changes is going to cure
Correct.
everything. But the reality is, how does this fit into the broader picture of your health? What does this mean for your body? What should we be looking at? What are your other levels that are present? What other screening studies do we need to be doing? What are the follow up? And then also comes down to, what's the quality? Because if we're giving a treatment, you and I are doctors, right? We can't afford to have a bad outcome in a patient, not only because we care so much, but because we're held to a much higher standard than anybody else. And so, I mean, maybe this is a good opportunity for you to tell everyone watching, what makes us select like a peptide provider or a stem cell provider for the quality materials that we're going to be using to treat our patients.
Yeah, I mean, I think a patient really has to have confidence in the person that's taking care of them. And it's again the time we put with our patients to ensure that they are educated. The best patient we can have is an educated patient. And a lot of times patients are fearful of asking questions, and I every time I get on a call or a consult with a patient, it's always ask whatever question you want. I'm here to help you. I'm here to help you guide you through your journey and make sure you make informed consent. And then it's also, trust in the products that we're using. You saw something on Instagram today that people are selling peptides in bodegas in New York, which is just scary. Um, I think both of us really pride ourselves on making sure we only go to the best labs, the best facilities, the best PhDs. We're looking very closely at things like a certificate of analysis, for instance, for stem cells. What is a certificate analysis? Why is this important? Why should every patient be asking every provider for this? So, in short, a certificate analysis is just a document directly from the lab that goes over, all the testing the product has been through, how long this product has been made, what expiration timelines are, what batch this came from, where the product came from, and also looking at things like sterility testing, looking at bacteria testing, fungal testing, virus testing, genetic testing of the product itself, and then also viability. Like, is what the product you're getting actually a live product and something that's going to help you, or is this just some stem cells diluted in water? So every patient should be asking every provider for a certificate of analysis. And if someone says we can't provide that, that's a huge red flag. For us, I give it to the patient before they even ask. We have nothing to hide. We're only partnering with the best companies such as MuseCell Innovations and Dezawa MuseCells, and that company as well is very transparent in the product that they want us to use.
So you mentioned Dezawa MuseCells, and we talked about it just briefly before, but is that something that anybody can get, or does Stems Health have kind of a first nod from the company and is allowing our company to purchase them before anyone else, and why?
Yeah, I wouldn't say. I mean, so we partner with MuseCell Innovations, very strategically. I truly believe they are sort of the leader in regenerative medicine. They hold themselves to a very high standard. Everything they do is in the best labs, imaginable, using the best products, using the best technology.
Mm.
Brand new bioreactors just for producing Desawa Muse cells. And with that, they want to hold themselves to a high standard that their product is only being used by approved physicians and preferred clinical partners. And luckily, through our relationships, we were able to, be able to work with them, and we are a preferred clinical partner for MuseCell Innovations and the ability to use Desawa Muse cells.
No, it's amazing. I mean, I think you and I care more about giving a great outcome to a patient than pretty much anything else. I mean, like we really just want to make sure that what we're doing while we're here on this earth is to benefit the health and, the
Yeah.
well-being of another.
And it's obviously, I mean, with some of the stuff you do, it's different. Every patient has practicality to help with medicine. But for me, I'm very selective in the patients we treat as well. And I'm very quick, not very quick, but, I do tell patients no sometimes. Like, I don't think this is the right option for you. I don't think this is going to help you with the expectations you want. But that doesn't mean we turn them away from the practice. It just means we got to try other things first before we jump into an injection of the spine after a patient's had multiple surgeries and has fusions and instrumentation in them. I've heard horror stories of, patients traveling internationally or even in the United States, unfortunately, where doctors just say, yeah, we can fix you. And they get no results. And now they're frustrated by the system. They think this product doesn't work.
Mm.
But it's really about, patient selection, taking the time to put together a tailored treatment plan for every patient, and understanding that each patient's unique. It's not just an algorithm or a cookie cutter process for every patient.
Let me ask you, because you mentioned spine, and spine is obviously very scary, right? We're thinking the spine, it's going to be close to the spinal cord and the nerves, and maybe this could be a real scary outcome. Obviously, you train, you've stopped counting at 20,000 procedures, pretty much on the spine. When is stem cells, Dezawa Muse cells, used in the spine, and can this actually help a herniated disc? Like, what's your patient selection criteria, and can you like maybe talk to who this works for?
So spine, obviously a very unique structure, right? It's complex, a lot of moving parts. And then as you mentioned, the spinal cord, sort of the communication for the whole body. And no need to say we don't want any injury to the spinal cord or the surrounding nerves. The patient selection it's unique. I see a lot of patients who are athletes, young individuals who just had an acute herniated disc or a big flare up of the joints of their spine. And then also patients who are older and have had chronic back pain, chronic neck pain, degenerative disc disease, impinged nerve, sciatica, a lot of different conditions that come through the door. There's no ideal patient. The both subsets of patients see improvement with these conditions, but again, it's more about the tailored treatment plan to make sure we're not just injecting one component of the spine, but we're treating the spine as a whole. Meaning, every time I do a spine procedure, we're treating the comprehensive spine unit. Meaning, we're targeting the discs, we're targeting the nerves that are inflamed, we're targeting the facet joints, the ligaments, the tendons, all the supporting paraspinal structures to ensure longevity of that spine and the outcomes that we want. Who's the right patient? Obviously, first we need imaging. Everything is based on diagnostics, and I want as much data as I can have to make an informed decision on the patient's treatment plan. Um, and then also the patient has to be committed. Spine is tough. It's not an easy part of the body to fix. The patient really has to be committed for the aftercare as well, with the physical therapy, the core strengthening exercises that go with it, the continuous follow up to ensure that they get the results that they really want.
That's great. It's amazing. Um, you didn't mention spinal stenosis. Patient that comes in with spinal stenosis is stem cells, exosomes, Dezawa MuseCells. Is that a treatment for it?
Yeah, absolutely. I mean, stenosis is a tough condition to treat, right? Because it's not necessarily a tear we think of traditionally or an acute process. It's something that's been happening over time. But really, where we can have success is trying to strengthen the interspinal ligaments to give more stability to the spine. Unfortunately, the only other treatment option for stenosis is surgery. A surgeon goes in, shaves off the bone, opens up the spinal canal, but obviously has long-term ramifications for a patient. Um, we can certainly reduce inflammation in the spine. We can help strengthen the spine, give the spine more stability, and hopefully avoid that surgery. If we can improve quality of life and take a patient's pain from a 10 out of 10 to, hopefully a 3 or 4 out of 10. 3 out of 4, 10 to a lot of people it seems like pretty high pain, but for someone who's lived 10 out of 10 pain their whole life, that's significant improvement in their quality of life. Just being able to walk through a grocery store without having to sit down or stop or be hunched over a shopping cart or be able to bend
Pick up
over
their
and play with
kids.
their kids or
Yeah.
grandkids. That's a big improvement and ultimately keeping them off the operating table.
Let me ask you this, because a lot of patients have come to you in the past, let's say when you were training or post-training before you started Stem Cell, and they said, "Hey, listen, I have back pain. Steroid shots have helped me in the past. Why wouldn't I just get a steroid shot now? Like, why are you advising them to get a regenerative medicine, bioorthologic product instead of just kind of going for a easy peasy,
Easy
so to
fix,
speak?"
right? The quick
Yeah,
fix. Yeah, steroids, I have nothing against steroids. They're, when used appropriately, they definitely certainly have their role. The problem with steroids is when we're limited by how much we can use, right? Steroids can also cause degradation in the body. So they can degrade bone, joint, cartilage. So if a patient's getting repeat steroid injections, which is often what happens, the steroids can cause damage to the body, which can then further inflammation, further pain. And so while it is a quick fix, you will get better, quickly. It doesn't set you up for success for the long term.
mm,
It's kind of, it puts you in this cycle of repeated injections, repeated pain, and needing more of the same, which really doesn't get you better. There's a lot more literature now that's actually, randomized controlled trials, and meta-analysis looking at comparing steroids versus regenerative options. And regenerative options to some degree are showing better and better results than steroids. But then when you compare them head to head for long-term outcomes, the regenerative medicine options are certainly far superior. The goal with these injections is, I hate using the word one and done, but we do one injection and pain relief for months to years rather than just, a couple of weeks or a few months of relief that we often see with steroids.
no, it's interesting. Yeah, I mean, the spine can, really debilitate someone. It's one thing to have shoulder pain, but it's another thing to not be able to stand up straight or to be able to walk without, you know, having pain or inability to ambulate.
Yeah, I mean, you've seen me when I've had my back pain. I've had herniated discs in my low back, and it is truly a debilitating condition. I'm able to relate with
I
my
mean, depression
patients.
ensues, right? I mean,
Yeah.
people abuse pills, they're unhappy with the quality of their lives, and, changes kind of like their ecosystem around them, the relationship with their partners, the relationship with their
It just makes the
colleagues,
simplest thing,
and the world.
difficult, right? Just sitting on the couch and having to go to the bathroom, you think twice because, it's going to be so much pain just to get from the couch to the bathroom or waking up in the morning and know your whole day is going to be centered around the pain. It certainly has a mental effect on patients, and patients will do whatever they can to be out of that.
Yeah, I think a spine is really the big one. I mean, and I think that's why people come to you so often because you're so comfortable working in the spine. It's not, you're not a nurse practitioner, you're not a PA that perhaps is great at doing a shoulder injection because they've done 1,000 of them and the landmarks are there.
Sure.
But really, going to someone who's so qualified to do the spine, a very delicate area, not only makes you super qualified for the spine, but also hyper qualified for doing those other pain areas, right? Shoulders and knees and hips and everything else we learned in, nursery school rhymes and toes. But let's move on to kind of like the knee, like when you do knee injections, what are the indications that you're looking at for when you would be using a stem cell versus saying, "Hey, no, you need to go see a surgeon because I don't want to just inject you, even though you want it and you've watched a podcast, maybe ours, maybe, Joe Rogan's, but no, this isn't the time to get a knee injection. You need surgery." What are the indications that you're saying, "Yeah, of course, like there's great literature and you're going to actually feel better in the next couple of weeks for the long run?"
Yeah, it's all about patient expectation, number one, right? And so, like, you nailed it right there. That a lot of patients come in and it's like, I heard stem cells are going to fix me. Just give it to me. I'm like, well, let's pump the brakes. Let's really look at kind of where we are. Certainly, if there's a full tear, we have a full ACL tear, a big meniscal tear. Regenerative medicine options can certainly help, but they're not going to give the knee the true stability and the true recovery that patients want. So a lot of times it's not necessarily you have to have surgery before I do this. Is let's talk to a surgeon first and see what they say and make sure we have a collaborative plan
Sure.
in place. And then it's expectations, right? If I have an NFL player come to me with an ACL tear, it's like, well, no, we wanted to get you back on the field.
Give us a name, all the NFL players that come
No,
through.
we can't do that. Not quite yet. But we want to get you back on the field. We want you moving at a high speed. I think surgery may be an option. But post surgery, let's talk about regenerative options, stem cells, Dezawa MuseCells to keep that knee healthy for future
But how about
seasons.
pre-surgery? So let's say the patient criteria is you don't need surgery. You don't need a total knee replacement. You don't have a
Right.
full thickness ACL tear. What clinical conditions do patients come in with and you go, "Yeah, of course. This is a great one for you to have actual regenerative medicine."
Yeah, I think early onset arthritis, grade 1 or 2 arthritis is great at sort of helping with cartilage remodeling, helping blood flow to the area, reducing inflammation. Smaller meniscal tears, MCL sprains, LCL sprains, or even tears, patellar tendinopathy for the knee specifically. All those conditions are great options for regenerative medicine.
And how long would you say that procedure takes? Person comes in, not pre-consult, but person comes in day of procedure and they need the injection or they're scheduled for an injection for a MCL tear or patellar tendinopathy.
Yeah, I mean, obviously it starts with, even though we've had a full consult, all the times patients, we have to re-educate them, tell them what we're doing. Before I do any injection, it's a full diagnostic ultrasound scan for the patient, which can take 10 to 15 minutes. Because even if we have an MRI ultrasound, we want to see it again, see how the injury may have changed in the past few
Progressed.
weeks
Sure.
since we last saw them. Um, we mentioned it earlier, we do draw biomarkers for the patients for labs. And then, the procedure itself can take anywhere from, 10 to 15 minutes. It's relatively quick. We're not in a rush, but it's very precise. Everything I'm doing is under ultrasound guidance. So we're going exactly to the areas of injury. We're putting the needles right where it needs to be and watching in real time to make sure the stem cells or Dezawa MuseCells or PRP, whatever product we use, is entering the joint space, going right to the meniscus, going to the MCL. In total time for a patient, I'd say about an hour of total clinic visit time. Again,
For the
we're
procedure, 10 minutes,
10 to
15
15,
minutes.
yeah.
And is this a person who's, like, nervous for needles or a person who doesn't like any pain whatsoever? Talk to me about, like, what the pain is like of getting one of these injections.
Yeah, we have discussion all the time. Patients are extremely anxious with needles, and
Sure.
and understandably so. I don't like needles going into me either if I can avoid it. Um, but I tell most patients, their safety is number one priority. Number two is their comfort. And having done so many of these, I'm very good at making sure we anesthetize or give enough lidocaine and numbing medicine at the area. I'd say the vast majority of our patients that we see, when I tell them I'm finished, they don't even know I started.
Right.
So they're extremely comfortable. We talk them through it. We have a great team, great staff that make sure they're comfortable, and make sure it's an enjoyable experience for them.
So it's a very local anesthesia. This isn't patients aren't expected to go under anesthesia.
No.
They're not in a surgery setting where they're getting their knee injected and they need to be knocked out.
Correct. Yeah, this is an outpatient procedure. That being said, we do have patients who are just adamant they can't do this awake. And if we need to, yeah, we have the option to do this under a sedation or anesthesia if
Mhm.
needed. But for many reasons, preference is to do this while the patient's awake.
Okay.
Yeah, we talked a lot, a bit about orthopedic injury, but obviously with Sawa MuseCells, there's other applications as well, and a lot of these are still sort of in early research trial, but showing a lot of promise. Um, what kind of excites you about Dezawa MuseCells? What sort of conditions do you think are going to be sort of in 3 to 5 to 10 years, we're going to be talking about this more and more, and then becoming more not necessarily first line therapy, but great options for patients?
I think what I'm most excited about are neurodegenerative conditions and post-myocardial infarction conditions where, patients underwent an incredible stress on their body, whether, having had a heart attack and now they had many, many cardiac myocytes that were damaged in the process, or even a stroke where they had a lot of nerve cells within the brain architecture that are now either scarring or going to be in the process of having, that watershed region where that brain may not come back and function. So definitely very excited in the acute circumstances, but also very, very excited about conditions that really have not had much progress at all since, maybe the initial treatment came out, and those two being Alzheimer's and Parkinson's. And, I think those are both debilitating conditions, not only for the patient, but also for the patient's family. I think that we're seeing great results come out in published literature showing that, Parkinson's patients have greater increased return to function, and Alzheimer's patients with increased objective scores on a mini mental status exam. So those two conditions. And then really interesting, there's a lot of studies that, we talk about regarding autism and the different research that's happening here locally that I think we're going to start to participate in for autism studies for pediatrics, because what actually is happening in the brain, and can we reverse that using these Muse stem cells in order to, improve the quality of brain development in pediatrics. So, I think more in terms of systemic and these types of processes, how can we do more for it? I think that the literature really supports right now orthopedic injury, chronic as well as acute injury. And so I'm excited because we can treat patients in an incredible way now. But I think when you ask, looking at the future, what's going to be an incredible method? Well, I think people are going to look back and go, why didn't I do that sooner? I saw, some sort of tremor or some sort of rigidity start, and I was diagnosed with Parkinson's. Why didn't I start that sooner? I waited for the research to come out, or I started to see that, we did certain types of lab testing that looked at Alzheimer's markers increasing, and we have a family history of early onset Alzheimer's dementia. Why didn't I do this sooner? What did I have to lose? It's safe, I can afford it, and this is demonstrating benefits in clinical research trials, both in animal models as well as, in research in human subjects in different parts of the world. So very, very excited about
Yeah,
those.
I think the neurodegenerative conditions are going to be it's going to be a game changer for those patients, right? And like you mentioned, the state of Florida passed legislation last year in July approving the use of stem cell therapies for patients, and following this, several states have also started to come on board. I think Arizona, Tennessee, Georgia, and a few other states are starting to onboard stem cell therapy. Um, and like you mentioned, Florida, the indications really are for pain management, which falls under orthopedic injury and a lot of other conditions, and then wound healing. But what really excites me about these states kind of bringing this on board is that it gives both in the private and sort of academic sectors of medicine the ability to do more research.
Hmm.
And I think a lot of these conditions have been kind of held back in advancing further just because the research isn't done to have the appropriate clinical trials, the data, and sort of dosing protocols and how we're treating patients established. So obviously with my travel to international clinics and talking to people, they've been doing, Alzheimer's, ALS, Parkinson's, multiple sclerosis patients for quite some time and seen incredible results. And I've spoken with these patients directly, and they said they wish every patient could have these treatments because even though it's not a cure, it is significant improvements in symptoms, quality of life, energy, and just giving them hope for, more years and more years to come.
Yeah, interestingly enough, we've had some calls for patients with cerebral palsy, an early onset hypoxic ischemic encephalopathy that patients, no fault of their own and non-genetic in origin generally, but they suffered some sort of hypoxic injury to the brain at birth. And, in Duke University, they have very, very strong trials looking at the use of different types of stem cells, whether umbilical or hematologic based stem cells that actually given with hypothermia will improve generally the outcome of patients that had a hypoxic injury to the
Absolutely.
brain. And so I'm really excited not only for autism but also for cerebral palsy in patients that this is a debilitating condition, and if there is a solution, and Duke University, one of the foremost institutions in the world, is doing research and publishing it and showing how great the outcomes are. Why isn't this more available to individual patients
Correct.
and their families? And, I think that we're kind of like at the inflection point where research is now translating into clinical actual outcomes for patients that don't have to enroll in trial. And so, I think you and I are trying to be at the forefront of medicine and not just sit back and say, no, 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 insurance doesn't cover that, or this isn't FDA approved yet. The FDA doesn't mean that it's safe. The FDA just means that it was submitted for FDA approval. And so I think there's kind of like that nuance between, because it's not FDA approved, it shouldn't be approved. It's more because it hasn't been submitted for FDA approval, it doesn't have an FDA approval. Like a great restaurant could be the best restaurant in the world, but they didn't submit for Michelin to come in and
Right.
rate them. So, I don't want to like poo-poo the FDA, but at the same time, it really comes down to asking for an FDA approval.
Yeah, I mean, I think FDA approval is important. I think important for many things, but we commonly use products off label from
Mhm.
FDA use. But more importantly, it's just really
Steroid injections into the back,
yeah, correct. Someone recently told me that steroids are not FDA approved for
and no one questions
epidural
it.
steroid injections, but this
Yeah,
has been the standard of care for over 30 years.
mind blowing.
Yeah, it's
Mind
crazy.
blowing. You would assume that was the first thing that steroids
Yeah,
were used for.
it's so indoctrinated that no one even questions it through residency fellowship. It's just all you do, and it's not even FDA approved for that use.
Interesting.
Um, but I do believe safety and regulation is very important, right? We
Absolutely.
have to make sure that the products that are being used are appropriate, because there are risks with any medication, including stem cells, Dezawa MuseCells, PRP, bone marrow aspirate. My question for you is, what are some of these risks that patients, should be informed about or think about before they proceed with treatment? Or where I guess another way to phrase it are, what are common questions patients ask, when they come to you or come to me and say, I want to get this treatment. What are sort of side effects or adverse effects that I should worry about?
Yeah, I mean, one would be who's doing the procedure, right? Like who is this? Is this just a person who took a weekend class and says, "Hey, listen, I'm going to do stem cell injection or infusion for you." So I think it's one, who's the person that's doing it? Two, where's your product from? Like what is this coming from out of the country? Is this coming from a lab here in Florida? What's in the product? It says it's this, but is it actually there?
That
Certificate of
certificate analysis, yeah,
analysis. No,
exactly.
exactly. And then moreover, what am I expecting from this procedure? Is this going to be a quick procedure? Do I have to come back 3 times? Is this a monthly thing? What kind of outcomes? And so I think you and I, because we're doctors, we're honest. Maybe they're not so transitive that we're honest because we're doctors, but we are doctors because we want to help people. And so we pretty much are saying, we hope to be able to achieve an outcome that you're expecting, but we're not promising you anything. We're not saying, if you do this, you're going to feel 30 years old again. But instead, this is the best product that we know is available. Here's the research that supports our clinical indication and procedure. And we're going to use the best physician that actually is trained in using this. And this is the expected outcome we should have. Now, whether or not your outcome is going to be precisely that, it should be. I mean, you do 10,000 of these and you expect 90% to come out this way, but there's still a 10% or whatever the number is expectation that there's other things happening in the body. There's maybe other homing mechanisms going to a site of injury that we didn't really know about, and we're expecting
Correct.
it to go to the knee, but you actually have rheumatoid arthritis that you didn't know, or you have lupus that perhaps you haven't diagnosed yet. And so as a result of that, you're kind of sending all these paracrine signaling mechanisms, and all these S1P, receptor sites are getting flooded with the Muse cells because we're curbing inflammation. And maybe you don't have that expected outcome in your spine or your knee or your hip and whatnot. So, truly understanding what makes a patient a candidate and how they can get the greatest possible outcome from it. So you know, it's a conversation, an ongoing relationship.
What do you tell patients that come to you and say, "Hey, like I'm really, these stem cells and or these Dezawa MuseCells, they sound great, but it sounds like they're really promoting tissue growth, promoting formation of new tissues. Should I be worried about cancer?"
Great question. I mean, absolutely. I would say that the research that was performed by the labs that actually, I believe this was FDA approved as in Japan in 2023,
Correct.
2024,
Recently, yeah.
very recently, looking at that. Does this have what we would call in medicine tumor genicity? Does this have the ability to actually create aberrant cells? The answer is no, it does not do that in any published studies, whether animal models or human models, that it doesn't cause it. But I'd say you and I go a step further and say, okay, well, we understand the science, this doesn't cause cancer. Is there a cancer diagnosis that's present already? And no, we're not going to give you fuel for a fire. So we know it doesn't cause it, but we have selection criteria for our patients saying, are you up to date with your screening? Do you have a family history? Do you have a personal history of cancer? Was it treated? And we need a letter from your oncologist or treating physician to say they're cancer free. They've been treated. We're not worried about this. But, we answer those questions. We don't just poo-poo it and say, no, 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 you don't have to worry about cancer.
Correct.
People are scared, and
Yeah.
they come to us for an answer to say, this is the research. This is what we're going on. This isn't just an opportunity for me to make you feel more comfortable so that down the road, maybe it was just because you're 72 years old, everybody gets prostate cancer. Maybe they source it back to us. But the reality is, this doesn't cause prostate cancer. If anything, because we have the understanding that it reduces inflammation, inflammation is one of the greatest causes of cancer in the body,
So there could be
right?
some cancer. We're not saying this is what's going to prevent cancer, but there's, obviously systemically we look at it, we reduce inflammation, reduce stressors in the body, can certainly help to,
Improve the immune
potentially.
system that's
Correct.
overseeing the natural killer cells and the ability to kind of detect where there are cells that shouldn't be replicating because they haven't gone through the proper cell cycles.
Yeah, sort of maintenance for the whole body, a reset to prevent future diseases, potentially future injuries, a lot of different reasons these products can be helpful.
Which is really interesting. So, nowadays we live in the world of longevity and wellness, right? And
Correct.
so my specialty and focus has really been for the last decade, how do we see what's wrong with a patient, look at their lifestyle and try to augment that lifestyle with, proper changes to it, whether it's diet or exercise or hydration or supplementation and proper screening to be looking for things. But on a functional medicine side, really looking underneath it all at hormones and micronutrients. And I could go on and on about these things. But now we're in the part where we can be using IV stem cells in order to promote wellness and longevity in patients that otherwise are healthy. So we get so many patients that are a subset that say, "Hey, I have knee pain, or I have sciatica in my lumbar spine, or I have a tear in my meniscus." That yes, it meets criteria, but we also have patients and lots of patients that are coming in for IV infusions of stem cells. Why would you say those patients are coming in? What benefits are they expecting, and are those achievable through research that has actually come out?
I mean, it goes back to that word of inflammaging, right? This IV stem cells being able to get dispersion through the whole body and not just target a knee or a spine, but crossing the blood-brain barrier, which these Dezawa MuseCells have shown to do, to really help neuroinflammation, to target the heart, the kidneys, the lungs, different parts of the body that have high cell turnover, especially with vision. Macular degeneration is a big thing in the ophthalmology world of older people losing vision, having degeneration of these cells. And those IV stem cells certainly can help benefit sort of a systemic approach for the patient. So the benefits of IV stem cells are many, that we can target the whole body. It's a systemic, reduces inflammation, which is huge for the body. It kind of helps with cell regeneration or cell turnover. Um, and then promotes just longevity and wellness for a patient.
So when a patient comes in and says, "Okay, listen, my best friend went to Mexico and they got IV stem cells, and now that it's legal in Florida, I want to do it with you guys." Um, what how do you tell them how many stem cells you need and what's the expectation for how you're going to feel the day of, the day after, and perhaps 6 months later?
Yeah, I mean, our dosing is based on body weight for a patient, right? It's very scientific. We don't just say you need 100 million cells, which is what happens when you go to a lot of international clinics because they just have sort of an algorithm in place for the patient. We're very tailored to the patient. We look at sort of the system. We see what our goals for treatment are, and then obviously scientifically dose the patient appropriately. Um, yeah, expectation for every patient's different. I've had IV stem cells myself, and what I noticed immediately was a lot of the sort of normal aches and pains that I feel throughout the day, whether it's my knee, my shoulder, just kind of stiffness, just kind of slowly dissipated and went away.
You
Um,
mentioned your eyesight got improved right away. Obviously, you're wearing glasses, not just
Yeah,
for
so I mean, my
looks.
visual acuity just improved. I was just things looked a little bit crisper. The vision was crisper, color was a little bit brighter. A lot of the sort of mental brain fog that I had, it's 2 p.m. We're in Miami. I get a cortadito in the afternoon to wake up. That just kind of went away. I wasn't finding myself reaching for a cup of coffee, in
Hmm.
the afternoon. I was
So
sleeping.
perhaps some adrenal regeneration.
Yeah, absolutely, absolutely. Adrenal and the neuroinflammation as well. The brain was just processing a little bit quicker and
Mm,
faster. Um, with my athletes that I treat that we give IV stem cells to, and I felt this as well, that this word concept of feeling locked in, hyper focused, being able to concentrate, not being distracted was I thought phenomenal. It was really um it was almost like when we were in med school, and we were able to sit for 12 hours straight and just read text, right? Like I've lost that ability. I could never do that. But
sure.
after the stem cells, I was certainly able to lock in focus and just digesting information a little bit faster, being able to retain information. And it was a truly, unique experience that lasted several months to the point that I knew it wasn't just a placebo effect for me. There's definitely something working in the background.
That's great. I mean, I think it really is a testament to we're not just offering it, we're
Oh, we
also
believe in it.
saying,
Yeah.
"No, I want this. Like, this is a part of my wellness, longevity, long-term plan." But the long-term plan starts today, right? Like, if you see me interact with a patient, if you're a fly on a wall, I'm asking them how they're sleeping. I mean, I wear a Whoop myself because I wanna know how much high stress sleep, how much REM, how much deep sleep am I getting? How much water am I drinking? It's the things we're doing today that set the stage for that allostatic load in the future. It's not just that one infection like I alluded to before that set everything off, but it's what happened beforehand and what can I do today? IV stem cells, injections, whatever it is, to improve the quality of it, kind of going
Yeah, so
forward.
talk about that a little bit. Obviously, in your practice, you focus on a patient's health journey for many years at a time, and you do a lot of medical management with peptides, hormone replacement,
Mm.
um, cancer screenings, a lot of different modalities. How do you see stem cells, whether it's IV, well, specifically IV stem cells, fitting in sort of a patient's longevity, wellness sort of plan?
Yeah, I mean, I would say that to be well is a comprehensive plan. It's not doing one thing. It's not I smoke and drink and don't exercise, but I got stem cells the other day. Yes, do I think there's going to be benefit? Obviously. If you get a good night's sleep, there's going to be benefit from that. So I think that doing something is going to be helpful. So I think that, for me, it's foundational. If you kind of look at like Maslow's hierarchy of needs, I would say that is what we're doing every single day. How much water are you drinking? I mean, we're between 65 and 70% water. Are you actually getting so much water that you can, hydrate your kidneys, hydrate your organs, be able to sustain blood pressure and make sure that, things are being flushed and, removed, eliminated from the system? What's your nutrients like? Are you, giving your body more and more inflammation by eating a diet that's with tons of saturated fats or tons of sugars or what have you now. It's not a nutrition talk, but so many of these things. How is your body moving? Are you stretching? Are you spending more time at the gym looking in the mirror and lifting weights? Or are you spending more time having someone massage you, stretch you, teach you how to focus on
So, I
your
mean, all
core.
those, so the bot for sure taking care of yourself, but I guess
Sure.
more from a medical perspective, a patient walks in your door and asks, should I be doing stem cells? Is this something I should be doing? What's that conversation?
Yeah, I mean, it's a great question, right? So it's like I was saying before, it's a layered approach. If you're not doing other things, then I wouldn't say yes, do stem cells and it accounts for everything else. But if your focus is true health and wellness, I think it's a part of the conversation to say if you're trying to exceed your own expectations or recover from something that really took you out, I think this is an opportunity for you to do something that will probably set you leaps and bounds over anything else that you've tried so far,
Right.
especially for that person that's older who's going for a younger edge on life, whether it's to be able to carry their children or to be able to exercise more or to be sharper in the brain to be able to execute deals or to be able to spend long time in court or in front of a computer screen,
Seeing
trading,
patients.
seeing patients. I think it's an extreme edge. I think it's an extreme edge for those that really want that extreme edge. But going back to a question you asked me before, you mentioned hormones, and I think hormones and peptides are a part of the solution. I think peptides we can push aside for a second because there's obviously so many peptides we can discuss, but hormones are pretty much what's controlling a lot of our body's ability to function like it should, whether it's normal insulin, whether it's normal thyroid levels, but also normal sex hormones, right? So when we think sex hormones in women, we're thinking estrogen, progesterone, some testosterone, some DHEA, and the other ones that I mentioned, the adrenals and the thyroid. In men, mainly testosterone balanced with estrogen. But if those are out of whack, then we can't expect the rest of our cells to be performing like they did when we were young, when they were exposed and flooded to these types of hormones,
Correct. They
right?
balance everything in the body.
They balance, and we're expecting us to have energy and sex drive and focus and the ability to be excited about life. And we're a 62-year-old man, and our testosterone, total testosterone is 240, and our free is 35. We can't give them stem cells and just say, well, you should feel better because you got IV stem cells. We can layer that on top, but they need testosterone. And giving them back that, and there's been amazing research that came out in the past several years that demonstrate testosterone does not cause cancer, does not cause prostate cancer. But instead, how can we give a person their life back through testosterone therapy, but not just from their trainer in their gym who's going to give them an injection or tells them they should get this, but through medical management, understanding, do they have a swollen prostate? Do they need screening? Are they getting a high quality testosterone? Is their blood thickening? Are they using up iron storage that they have? Because testosterone is going to build red blood cells. But if it's building red blood cells, it's making more hemoglobin. If it's making more hemoglobin, it's using iron. But iron's used in different parts of the body. And if you lose it and your ferritin levels drop, you're causing stress. And back to the stress model. So, it's really understanding who is a candidate for what and then layering on top an IV infusion because we've already corrected for the other things. So I think it's really having an excellent team that's looking at you from a medical standpoint and pretty much how you're living your life, saying, you better be doing these things. And if you're not, start, and we're going to give you the cherry on top. And you're going to go, wow,
Yeah,
wow,
it's almost
where
like
did this
stem
come
cells are
from?
just a piece of the puzzle, a big
That's
piece,
right.
but we have to look at everything.
That's
It's
right.
not just, yeah, I think it's important for people listening and patients and everyone that the stem cells are not, we're not promoting them as a panacea to cure everything, right? They're certainly going to give
Not in this
patient,
episode.
not yet. They're going to give an edge, a boost, push you a little bit further in the right, a lot further in the right direction. But if your foundation, like you mentioned earlier, your sleep, your exercise, your hydration, your diet,
Sure.
the hormone balance, if all that is not teed up appropriately first, you're not going to get the maximal benefit from products like this,
Right. Right.
which is important.
So I'd say this is the part of the podcast where we start singing head, shoulders, knees, and toes.
Head, shoulders, knees, and toes. Let's
Knees
go.
and toes.
Bring the guitar out.
Right. So yeah, not yet. So let's talk about the spine, right? And about the different layers of levels of the spine and layers, so to speak, and the conditions that you treat. So let's start like in the cervical spine. Talk to me about what conditions you treat and such.
Yeah, absolutely. So cervical spine, thoracic spine, lumbar spine obviously have very different sort of intricacies and details, but overall sort of the same clinical pictures when we talk about injury. So with cervical spine, some of the most common injuries that we're treating, one are cervical spinal stenosis, herniated discs in the cervical spine, which then can lead to impinged nerves and radicular symptoms, meaning pain radiating into your arms, your hands, numbness, tingling,
Hmm.
cervical disc degeneration, but also cervical facet joint degeneration as well. And degeneration, excuse me, facet joint degeneration in layman's terms translates to arthritis of the cervical spine. Then when we look at the lumbar spine, very similarly, we have herniated discs for the lumbar spine or the low back, impinged nerves causing sciatica pain, meaning pain into your glutes, your legs, your feet, with numbness and tingling, as well as lumbar disc degeneration and lumbar facet joint degeneration as well.
Now, when we're doing a spine procedure, can you walk me through where you're doing it, your protocols, and as well as, like how long, like what's the patient expecting from while not pre-experience or post, but while you're there, how long does this procedure take?
Yeah, a lot of the spine procedures I do, it's a delicate area, and we want to make sure the patient's comfortable. And when we do the spine, whether that's neck or low back, it's not just as simple as one injection. It's going to be multiple areas targeted because, as you can imagine, there's multiple levels to the spine and multiple joint structures. So a typical, say, low back lumbar injection can be upwards of 7 to 10 total injections. And for this reason, I really prefer doing these procedures for patients under sedation. So we take them to a quad A certified surgical facility where we have a full team, full staff. Obviously, everything with the spine is done under x ray or fluoroscopy guidance. So I can directly visualize the levels of the spine I'm going to, making sure we're not near any blood vessels, not near any nerves, and extremely precise and accurate. The experience for the patient from start to finish can be about an hour, hour and a half. They meet the whole team, they meet the anesthesiologist that's taking care of them. We do the procedure, which can take, 20 to 30 minutes per patient. And then the recovery, oftentimes from the sedation or anesthesia. Um, for the low back, sometimes or often we will just do this under local anesthesia so the patient doesn't have to have sedation. But for the neck, I think it's important that the patient, just for their comfort and make sure they're not moving or uncomfortable, we do it under sedation for the
Now, a
patient.
patient, let's say they're not coming to us for the first time, like, hey, I have some neck pain, let's go see a stem cell clinic. But they've already gone through perhaps some sort of interventional pain before, they've had steroid injections. Would you say that the experience, not the stems experience, but the experience of getting an injection for stem cells is very similar to the experience of getting steroid
Yeah, I mean,
injection?
and then they were doing an injection in the spine. So, I mean, I can't speak to how other providers and physicians do their injections, but obviously, like we mentioned earlier, comfort for the patient is important to me. So a lot of local anesthetic, a pain-free procedure for them. But in terms of the injections, yeah, it's very similar in terms of
Like the time of
the time,
procedure and
how they're
fluoroscopy?
going to feel, the equipment used, everything at a very high standard for every patient.
Okay, great. So if a person's familiar, like, wow, that was super simple. I was terrified to get a steroid injection or radiofrequency ablation procedure for my lumbar spine pain. This isn't much different. It's just a much different uh, actual stem
Product,
cells
right. So,
product
the
being
injection's the
used.
same. It's more so about one precision of the injection, but also kind of what we're screwing onto the
Sure.
needle when we inject.
Okay.
So, the higher level product to make sure that it's not steroids.
And I
Correct.
really ask this, and I'm like, kind of like really getting in on
Yeah,
it because patients are scared, right? Like we see it, they come in our office and they try to be tough, but hey, listen, this isn't like, should I or not do the remodeling on my house? Like I've heard that, whatever. This is their body, this is their neck, this is their lumbar spine. There's fear built into it. And
of
not
course.
only like the fear of what could happen, but am I going to feel pain when I'm there? But the reality is, if you've had this before, whether through steroids or PRP or something of that nature, this is pretty much just changing the type of injection that's being given, but it's still a 10-minute procedure.
Correct.
Okay,
Yeah.
that's great. Let's move on to another part of the body, the shoulders. Can you talk to me about when a person comes in, why they would come in for a shoulder injection? What are clinical conditions that we treat really successfully with orthobiologic stem cells, exosomes, PRP within the shoulders?
Yeah, I mean, shoulder is probably one of the most common injuries that we see in our practice, right? I think we see a lot of patients who've played a lot of sports growing up through their life, whether that's baseball, football, racket sports.
Are you just saying that you do a lot of professional athletes
We
that
do,
are
but those the everyday the padel players that are gaining
don't you
popularity
love
now.
when you watch one of your players that you've treated go into a Super Bowl game or go
Oh,
into
the
an
best one,
NBA
you text
finals?
them afterwards and they do something big in a game, and I try to take credit from them and just,
Yeah,
jokingly text them, but
right.
no, it's
Or win a
incredible.
championship for padel or tennis, and it's just like, well, I know their secret sauce.
Yeah, we know we know how what edge they have over everyone else and why they're
Right,
doing better.
right.
It's great. But the shoulder very common to see. We treat arthritis of the shoulder, labral tears in the shoulder. The most common we see for shoulder are rotator cuff injuries. So
Hmm.
tears or strains in the supraspinatus, infraspinatus, teres minor, and subscapularis muscles. Those are the muscles responsible for rotation of the shoulder, allowing your shoulder to move in all different directions. And it's a very common injury to have. I think if we scanned 100 people, we probably find at least 90% of them have some sort of rotator cuff injury that's either there in the early stages or progressing to
A
get worse.
tear or like a tendinopathy at the insertion point?
Yeah, it's a good question. So both, right? So oftentimes we see a lot of tendonitis or tendinopathy.
Hmm.
Um, the tendinopathies quickly can't progress to tears, and a tear doesn't have to be 100% full thickness tear, right? That's more of a surgical console when we get to that point. But even small tears can cause significant discomfort, especially for active individuals.
No, absolutely. I mean, I've been in clinic when I watch you perform a physical exam on a patient, pushing down on their arm and having them move it in certain rotation fields, both before doing imaging studies and even after doing imaging studies, because sometimes an imaging study will show something that's actually not where their pain is. And so it's really interesting that, like, you're not just treating something that's been seen on imaging, you're treating the patient. You're saying, this
Absolutely.
is not actually where your injury is. Let's go anterior here and let's see actually what's happening in the front of your shoulder.
Yeah, it's important. It's again, it's precision, right? It's the imaging is just one set of data, but they got to listen to the entire patient story and what's actually bothering them. But along those lines, we do multi-targeted injections. So just it's not just simply into the shoulder joints. Like we mentioned, the spine is under X-ray guidance, the shoulders, the knees, the hips, everything's precise, usually under ultrasound guidance. So I can see the muscle, the tendons directly. We can visualize tears directly and go directly to those areas to make sure that we're getting max benefit for the patient.
What's that experience like for a patient where they, I'll lay it up for you, but a person comes into clinic, we've already done an MRI or had imaging and ultrasound on their shoulder. They show up, they've already signed their consents, they come in for day of procedure, they've checked in, they've had their labs taken. Now they're sitting on the table and they're about to get their injection. What how long does it take? And what would you say your process is giving the injection and then right after the injection?
Yeah, I don't want to say I make it fun for the patient, but I want them to be involved in the care to some degree. So I think when, the entire process for, say, shoulder injection, probably about 30 to 45 minutes for them. Um, but I really like them to see what we're doing. And the cool thing with the ultrasound is it's live imaging. So when I put the probe on them, they can see in real time and we point out exactly where we're going, what the issues are. And I think patients are often amazed. They're like, oh, wow, this is what my shoulder looks like. He's actually, I can see the tear. He's showing me the tear. I can see the needle actually going to this area. And, it helps them understand their injury more. It gives them confidence that, the product was put in the right place. And I think a lot of times patients, walk out like, oh, that was a pretty cool experience that I just had. And I feel very confident in the treatment that I got.
When you say 30 to 40 minutes on the procedure, you're not talking about needle in
Sorry,
arm.
patient's entire time, the patient's time in the clinic, 30 to 45 minutes, but the actual procedure, yeah, depending on how many sites we're treating, probably about, 10 to 15 minutes of injection,
Okay.
but the needle not
So that's
in them for 10
palatable. I
minutes.
mean,
Correct.
no one wants to go in for procedure, especially while they're awake. And so if you are awake and you're numbed because you've done some local anesthetic, having a needle in for 5, 10 minutes is not something to be necessarily terrified about.
No, it's an easy experience. Like I said, the patients, it's the majority of them enjoy it. They have a very comfortable experience. It's pain-free for them. We try to give it local anesthetic, make sure they're comfortable. And obviously, like I said, their safety number one, but their comfort number two. And we
I would
want them
also
to,
say we have a beautiful clinic.
oh, it's
And so when you're
world
sitting in the
class for sure.
room, you're kind of looking around, great view, great artwork on the wall, beautiful furniture, and you're feeling really comfortable. Okay, like the surrounding of me makes me feel very comfortable. The nurse or medical assistant that's there is holding my hand. Wow, I've never experienced this kind of healthcare before, who actually is making me feel comfortable, who brought me a glass of water, who's making me feel kind of I'm just the focus of what's going on here, and then it's 5 minutes of an injection. So it's not, you're not in a freezing operating room, you're not with beeps going on, what's that screaming going on in OR2. This is a very placid, kind of
Yeah, we
serene environment where you're getting the highest quality of care.
yeah, we work very hard to make sure that the patient experience is not sterile, right? It's not scary and overwhelming. We want them to be comfortable from the moment they walk in the door.
Right. The
And
sterile is
just the procedure.
just the shot,
They're not
right?
no patients waiting in a waiting room for half an hour or an hour just to see the doctor. If your appointment's booked at 9 a.m., 9 a.m., you're meeting the doctor and we're getting you ready for the procedure. And we
Sure.
understand that, patient's time is important too. And, a lot of people have meetings to get to, kids to pick up, and we want to respect a patient's time and make sure it's, not just wasted sitting there waiting to see someone.
So let's go to the elbow. So the elbow has a lot of things that can go wrong. And, generally speaking, it doesn't go well diagnosed. Can you walk me through certain types of clinical conditions and, potentially subjective claims that patients are coming in for their elbows?
Yeah, the two big words we hear with elbow are obviously golfer's elbow and tennis elbow. And the two are kind of same type of injury, just on different sides of the elbow. So we have medial collateral ligament and lateral collateral ligaments of the elbows, and that's often what gets
Inside or
strained.
outside?
Exactly.
Yeah, okay.
This happens with a lot of racket sports, tennis, padel, pickleball, and obviously golf, because there's a lot of rotation of the elbow. And
Okay.
these ligaments, these tendons get strained, can have tears there, and then that precipitates a lot of pain for the patient.
And then they stop doing what they love to do because these are not often, we're not always just treating golfers that are on the PGA
Correct.
tour. We're treating the
Scratch
individual
golfer,
who's
yeah.
loves to play golf, but now he's just either holding his shoulder up or he's grinding his teeth and he's just wondering whether or not he can go on that golf trip with his buddies because his arm is just killing him
Yeah,
all
we
the
talk a lot
time.
about athletes, but everyone's an athlete to some degree, right? We live in Miami. Everyone wants to stay healthy.
Even mathletes are athletes.
The
Yeah.
math team, I can see you. Were you on the math team?
No, that was not my
Oh, I
forte.
dominated the math team. Yeah, we
Okay,
were.
great.
But just people want to work out. Everyone wants to stay healthy,
New
wants to stay
research
moving.
came out and 1 + 1 = 3.
Stay healthy, stay active, and just lifting weights. Being able to do a push up for someone is important. But the shoulder, elbows hurting, they can't even do that. So it's more so than just getting to play tennis or sports. It's just staying healthy and active on day to
So when
day.
you talk about medial or lateral, inside and outside of the elbow and golfer's elbow, tennis elbow, tell me about that experience. So a patient comes in and they say, I've had imaging and I know that I have golfer's elbow, and they feel like a really smart patient. They know exactly what they have. What's that procedure like? How long does it take to treat? And what's the expected outcome from that?
Yeah, so the procedure itself is it's very simple for a patient. They come in, everything is under ultrasound guidance. So we're looking at the ligament in real time and taking a needle directly to the site of injury. The entire injection process, maybe about 5 to 10 minutes for a patient. We give a lot of numbing medicine to make sure they're comfortable, that it's a pain-free experience for them. And then obviously the conversation is the aftercare is important as well. And our expectation is we have to give it at least 2 to 4 weeks to see how the results work for that patient. But that doesn't mean we're not in communication with the patient. We stay in very close touch with the patient. We set them up with great physical therapists in the area to maximize their outcomes, to improve blood flow to the area, range of motion, and keep that elbow strong through the recovery
We
process.
spoke about the different types of regenerative medicine products that can be used for a clinical indication like medial or lateral injury to the elbow. What are you mainly using? Are you using PRP, exosomes, stem cells, MUSE stem cells? What would you say has the greatest benefit for perhaps these types of tendinopathies?
It's really dependent on the patient and the injury and how extensive it is. Obviously, for say shoulder or specifically elbow in this case, all three products you kind of mentioned, whether that's PRP, exosomes, or stem cells slash Dezawa MuseCells, can have tremendous benefit. And rather than me always telling a patient what they need, it's more about having a conversation with the patient about what outcomes are, what their expectations are, and how do we get them there. Um, Unfortunately, these are not necessarily cheap options. I think they're affordable for many patients, but sometimes cost does come into play here. And the analogy we were talking about the other day is, It's like going to a steakhouse. You can definitely order a great steak and you're going to have a great experience, but there's definitely a difference between getting a filet, an American Wagyu, or that Kobe A5 Wagyu that you can get. And that's kind of the difference between the PRP, traditional stem cells, and the Dezawa MuseCells. For a discerning patient who says, I want the absolute best, I just want to do this one time and know it's going to get better. That's where those Dezawa MuseCells really come into play, to inject those.
Yeah, I love the analogy of the short long way home and the long short way home. And
Right.
and sometimes when a person takes a shortcut and they go, let's just go for PRP, it's the cheaper. There's a long path ahead. Not only do you have to get one,
Correct.
but you have to get three, and they have to be back to back. And the expectation is that it should help you, but it's probably going to come back. But if you go for the long, if you go for the one that you know that the journey may have costed a little more money, and you know that perhaps this is going to be something that you required a little more lab testing in advance to make sure that you meet our pre-screening criteria, that your journey home should be for the long run, long term,
Right.
shorter.
Yeah.
And as a result of it, so I think a lot of that kind of analogy plays in when you're choosing a certain types of product. You injected my knee for my MCL tear with exosomes. My expectation that it's going to feel great for several more years, but I may need another treatment. But if you gave me Muse cells from the start, then perhaps this would be something I never have to think about again.
Hopefully,
And so,
potentially, yeah.
yeah, so it's an interesting expectation for, are we treating an acute injury, get back in the game, and we'll come back to it? Or let's just do one and done. And expectation is that, yeah, we may have to treat your shoulder because we treated your knee. It's not going to go to both places at the same time, targeted therapy, but let's go for the best from the start and never look back. I'm a musician. And so whenever I'm trying to decide, should I get this amp or should I get this pedal or should I get, these types of monitors for mixing, the question is, do I want to upgrade later, or should I just wait, get that which I know to be what I want today, and just be happy with it for the rest of my life? And so,
It's
you know,
usually the latter. The latter
it's
is usually the answer in most
it's
things, right?
usually the answer. And
Yeah.
and, and so, it's take your time, think about it, choose the best. Don't don't make the mistake of just doing it quickly and rushing to a decision. Understand what it is that you're getting, be happy with it, and know that we've done our homework in advance to say we have the best doctors, we have the greatest product, we have a fantastic facility, and your follow-up's going to be great. Should be an easy choice to choose us, but maybe there's someone in Mexico that your friend went to, and you should just go down there. I think you're taking the long, short way home.
I agree. I think the patient, like we mentioned earlier, my responsibility is really to help the guide the conversation, to help them make the informed decision about what's best for them.
Yeah.
And the time we put into that, it's real. I'd say the majority of consultations is really walking through different treatment options, expectations, and kind of what I think would be the best option. And usually it's going to lean towards stem cells or Desawa Muse cells.
Right. No, it makes sense. Now let's move down, along the body towards the hips. You do a lot of hips, right? I've seen you dance. No, so
The
you
hips
you
don't lie.
the hips do not lie. So, we're here in South Florida. There are tons of orthopedic surgeons doing hip replacements, hip surgeries for the aged population, and maybe even just people who engage in a lot of sports. Talk to me about clinical indications that you use these orthobiologic regenerative medicine products for within the hips. What kind of outcomes are expected? And when you say, you know what, you need to go to surgery.
Yeah, it's a great question. The hip is obviously a complex structure as well. It's similar to a shoulder, and that's a ball and socket joint, and has 360-degree movement potential if you're flexible. But it also carries the weight of your body. Your upper torso and
Mm.
your upper half of your body, which can lead to a tremendous amount of stress and degeneration over time. For the hip specifically, I treat a lot of hip arthritis, a lot of hip labral tears, and then also, insertional tendinopathies, similar to the shoulder, but with the glutes, the piriformis muscles, those structures that kind of attach to your greater trochanter and help your hip open, close, rotate appropriately. Um, Something we see not a lot of, but frequently, is also a condition called avascular necrosis, which is there's limited blood supply to the hip. And patients often come asking, should I get stem cells for this? It's a tough question. For avascular necrosis, I think they have to see a surgeon first to make that determination, because we don't want to set false expectations that the stem cells are going to prevent that. And that disease progresses even further over time. And now they're needing, an emergent hip replacement.
Mm.
So again, we patient selection important, and we do sort of draw sort of boundaries of when and when we treat. The patient experience, hip injections are can be tough. There's a lot of vasculature and the nerves running in that area, so we have to be very precise in how we do these injections. Again, everything for the hip is under ultrasound or fluoroscopy guidance, so very precise, very accurate of where we're putting the needle, where we're putting the product. Similar to other body parts, the injection time maybe is relatively quick, about 10 minutes to do the procedure. If we're targeting multiple areas, maybe a little bit longer. And then the expectations for hip recovery, we have to get you into good physical therapy, give it at least a couple of weeks to see how you progress, and hopefully have incremental progress as time goes by.
Now, what do you say to a patient who says, "Listen, I don't know if I want to just do like a stem cell injection into my hip. Like I've had a steroid shot before, it worked for me. Why don't I just do another steroid shot for, X versus coming into you and you're charging 10X on, a stem cell injection. Why not just do a steroid?"
Yeah, the first thing I tell the patient is I'm very happy that the steroid injection worked for you, because now that gives me great prognostic information that future injections are also going to have results and be beneficial as well. With the steroids, sure, we can do another steroid injection, but we got to understand you're coming back to me already. You already had one steroid injection and you're coming back
Great
for
point.
another. So it didn't last for you. It didn't give you that long term benefit that you wanted. In addition to that, steroids can cause degradation to your cartilage, to the labrum. And if we keep repeating these steroid injections, it's just a matter of time before you're going to need a hip replacement. And my goal for you is really to avoid that hip replacement and strengthen your hip, remodel that cartilage, try to heal that labral tear or insertional tendinopathy or the insertional tear that you have, and prevent surgery as much as we can. And the best way to do that we have now would be with regenerative options like Dezawa MuseCells, stem cells, or PRP.
What's interesting is, when I see you do stem cell injections, you're going under ultrasound oftentimes, and you're looking at the muscle architecture and you're seeing places that perhaps there's fibrous tissue or there's tissue that's just really not mobile, right? So at a point you can target the joint, but that muscle itself is so short and so stiff that it's really just a stress point on it. That which can't bend will surely break,
Sure.
to the point where I've seen you go in and do a dissection of that muscle to break up scar tissue to be able to enhance the flexibility of the muscle, and thereby whatever you're injecting, whether it's just normal saline or actual like a regenerative medicine product, being able to give those cellular precursors to be able to allow that tissue to heal and restore a flexibility that maybe they didn't have since they were a little kid, where they had a lengthened piriformis, or they had the ability to actually internally rotate their hip to a point where they feel comfortable sitting, in a chair, and they're not constantly externally rotating their hips. So it's really interesting when you look under, the ultrasound, you can see more pathology than perhaps just that target site that you're
Yeah, I
getting.
mean, to many people and to many patients, it's just we're just doing one injection into the joint. But you are exactly correct. There's a great deal of care taken that I'm looking at calcified tissue, tight tissue, trigger points, making sure my needle is going through these areas to target those as well, to break up that tissue, to free up tight tissue, to help joint mobility, to improve vasculature and blood flow to the area, to help with long-term healing. And like we mentioned, couple that with great therapy afterwards that we help monitor, help guide with a doctor of physical therapy to get the results that the patient truly wants, not just let's throw some product into the joint and hope for the best.
Yeah, and what really struck me when you were talking about the hip was all of the other structures that's there. You can't just throw a dart in and hope to achieve, the expected outcome. You're looking for nerve, you're looking for perhaps sometimes lymphatic, depending on, if you're going anterior or
Sure,
lateral.
absolutely.
You're looking for vasculature, which is a fancy name for veins and arteries.
Arteries.
You're looking at things that perhaps are very important to the individual getting it. I mean, you stopped counting, but over 20,000 of these procedures.
Correct.
It's
Yeah.
not just, does this product work? It's, does this product work well when given under the circumstances of it being administered properly and not causing damage to nearby structures, that's really what you're looking at, not just do stem cells work? Sure, if you give an IV, maybe you have an expected outcome as long as it didn't, infiltrate outside of the vein. But when you're going into a joint, having someone who's done 20, 30, 40,000 procedures gives you the feeling that success isn't just a circumstance of luck. It's because you've done so many of these procedures. You know what to look out for and where you go, whoa, 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 whoa. This doesn't feel right at the tip of my needle. I'm pulling out.
Yeah, it's having done enough to know that things don't always go as planned, and then knowing when to stop and knowing how to correct in real time is very important. And we talked about spine earlier, even more so important for spine because there's a lot of people who do spine injections that shouldn't be necessarily, and that's when real complications can
Sure.
happen. And certainly with the hip, the shoulder, the elbow, the same thing. And that just comes with experience. That comes with dealing with difficult cases to understand, an easy case is an easy case for everyone, but difficult patients and difficult cases and pathology can really help sharpen the skills and understand, how to get yourself out of difficult
I'm
situations.
happy we have great lighting in here and you didn't shave today because you have a baby face, but you have some gray, you have some salt filtering
I
in
was
with
gonna
the
say, yeah,
pepper. Like you look young, but you've
it's
been
very
doing this for so
professorial. Yeah.
long that you have some gray hair and like you kind of want to trust the person that has been doing a lot of these. This isn't something to just come in for the first time.
Correct,
This
and
is
we talked about red flags earlier with certificate analysis, but it's, when you go to a provider and they don't have imaging, they're not using ultrasound or fluoroscopy, they're just kind of sticking a needle into the joint, that's a huge red flag,
or they
so
took a weekend class in
yeah, like,
ultrasound technique. You are double board certified in interventional pain
correct,
and
yeah.
anesthesia, and you've done more ultrasounds than perhaps a lot of ultrasound techs or orthopedic surgeons.
Yeah, like where did the individual train? Like questions the patient should be asking you
Hmm.
is, are you using imaging? Yes or no? Are you using ultrasound fluoroscopy? If the answer is no, see, you shouldn't
Run,
do that, right? Because if
right?
you look
Run
at
to stem
studies and
cell.
literature, it's they took experienced orthopedic surgeons who have been practicing for greater than 10 years, and they've set them into two groups, one without ultrasound guidance and one with ultrasound guidance for joint injections. And the group with ultrasound and guidance had close to 95% accuracy of the product being delivered where it's supposed to. The group without ultrasound guidance, and these are experienced
So it was
orthopedic
just using
surgeons. These are people who've
landmarks.
done thousands of joint injections, just landmark based on anatomy, or around 70% accuracy. So
Wow.
even in experienced hands of people who have tons of years of experience doing this, have done thousands of procedures, still only 70% accuracy of where the product is going. So, that image guidance, extremely important.
And so that can really change the outcome of saying, well, this doesn't work, so it must be something else, or stem cells don't work. It's
Correct.
no, it's not. It's called inter-rater reliability. Like, does the same person who does it the same way have the expected outcome every time they do it? Versus let's give it to people who are untrained or people who use like a landmark approach. They go 1 inch below the
Yeah,
acetabulum or
sure.
whatever it is, the clavicle, and then give an injection. But maybe you're not
But who
even where the
knows?
pathology is. It's
Well, it's
very
interesting.
interesting.
Everyone's anatomy is different. A lot of these patients we see are post-surgical, so there's changes in anatomy, so it doesn't always correspond to a
It's a
landmark.
great point.
Um, and then also, it's the other thing I wanted to mention is, these are not covered by insurance. These are cash pay procedures. A patient is making an investment into their health, and we take that very seriously. And I take that very seriously. And with that, we want to make sure we're doing everything we can to give the patient the best medical care possible.
Now, let me ask you, you mentioned it's cash pay, it's non-insurance based. For an individual who says, wow, this is out of my budget, for whatever the purpose is, I don't have $1,200 to spend on a joint injection or what have you not. I don't want to quote a price because different joints, different volume has different prices, and whether it's PRP or exosomes or stem cells or Dezawa MuseCells. Um, what do you tell that patient, and are there opportunities for them to do some sort of financing for procedures?
Yeah, absolutely. I mean, the greatest joy we have is taking care of people. We want to help as people as much as we can. And unfortunately, these are expensive treatments right now just because there's a great deal of work that goes into making sure these products are safe. They're coming from good sources, the labs, FDA approvals for the labs, all the testing that goes into this, unfortunately makes the product a little bit more expensive than maybe it will be in 5 to 10 years from now. But for those patients who, there are financial restraints, of course, we're going to work our hardest with them to come up with, payment plans or financing to ensure, that they get the care they want, and but they're able to, fall within financial budget as well.
No, that's great. Now, let's talk about two other like smaller joints, so to speak, the hands and the feet, starting with the wrists. What kind of clinical indications are you treating for in the wrists and perhaps throughout, like, just distal to that in the hand? And then also with the ankle and the feet, what are you looking at? What are you treating and what products
Yeah,
are you
so like
using?
common conditions we treat for the wrists and hands, we have carpal tunnel syndrome, where a patient has, sort of tightness in the wrist. It's causing neurologic symptoms for them. We have de Quervain's tenosynovitis, or which is just simply
Can you say that 10 times fast?
Quervain tenosynovitis, de Quervain tenosynovitis. I keep
Okay.
going. Um, which declines tenosynovitis, which causes a lot of inflammation at the thumb joint and movement and issues with the grip. We commonly treat that as well. With the hand specifically, the most common thing we see with the hand are trigger point injections
Hmm.
or trigger finger, where a patient's finger locks. Mine kind of locks too because I've had surgery or a broken finger here. But being able to release those tendons can help quite a bit. The products we use for wrists and hands very similar to other areas as well, with platelet-rich plasma, PRP, stem cells, Dezawa MuseCells, to really get long-term benefit for the patient. And then the ankle, obviously a complex structure, the foot as well. The ankle, the most common injury everyone sees for an ankle, and probably you've had it, I've sprained my ankle many times, is a sprained ankle.
Hmm.
When we think about a sprained ankle, that's really just injury to the supporting ligaments and tendons of the ankle. The ankle can roll over easily with eversion or inversion, and that creates a lot of instability. So we treat a lot of ankle sprains, which a little bit more precise when we do it, but the anterior talofibular ligament is one of the most common injuries that we see, that we're able to target that directly under ultrasound to help strengthen that, to give the ankle more stability for long-term healing.
Now, is that something that a person, let's say, basketball player, was in a game and they rolled their ankle, they come in with an acute injury. Is that something you're treating acutely? You're waiting for it to calm down, or is that something that
Yeah,
what's your
acutely,
process?
I'm sure you sprained an ankle before. When you sprain an ankle in the first few days, your ankle's swollen and blown up, right? And in that time, what we talked about earlier about that homeostasis in the body of balancing inflammation versus healing, your body's so inflamed that if I put product in that ankle, we're really just, it's just gonna be drops in a bucket. That's not gonna help as much as we want. So we got to give body the inflammation time to cool down, at least 3 to 5 days to let the ankle sort of reset.
Business days or regular days?
Or just work days, just regular business days.
Yeah.
Let the ankle reset, let the inflammation come down, and then be able to give, the high quality product for more long-term healing.
Okay, that's great. Um, let's talk about hair and aesthetics because, obviously we've been talking a lot about longevity and wellness, and we're talking about joints and spine and, injections directly into deep structures or, systemic absorption of stem cells. But let's talk about things that are, near and dear to a lot of us, which is how we look and how we feel and how we're kind of showing up in the world from the neck up.
Well,
Talk to
I'm
me about,
bald, so I'm gonna flip
yeah.
it back to you. Well, let's have you kind of jump into those questions with those great flowing hair.
Yeah, so, I was bald as well, and then I had 1 IV infusion,
So I
and,
guess the
here I
question
am.
for Dr. Mate, obviously we treat a lot of orthopedic injury in practice, but obviously I think a big emerging field of regenerative medicine is going to be for facial rejuvenation, hair restoration, which I think is great to move away from some of the normal cosmetic world of Botox, fillers, and sort of chemicals injected in the face and kind of find more natural options. I mean, just sort do you have a lot of patients that come your way asking for regenerative options for face and hair?
Yeah, I mean, I think it's a great question. I think at the end of the day, people are recognizing that which was the standard of care 10 years ago, 20 years ago, is certainly not the standard of care going forward. And we've not only been in a technological revolution for AI and such, but now we're in a healthcare revolution with DNA editing and stem cells. And I think that, how we work within stem cells really is setting the stage for future applications of stem cells and clinical research. With regards to facial treatments and hair treatments using stem cells, exosomes, and topical products. I think now we're entering the phase where we actually don't just freeze the skin in a place of where it is and not allow the muscle to move and, make it not wrinkle, but actually giving the ability of cellular regeneration, allowing the cells themselves to sprout new follicles on the head, be able to lay down new cartilage and new tissue within the face. So it's not just a glowing appearance because you had a PRP, vampire facial and it worked for a bit, but actually laying down tracks for new cellular development and growth. I mean, this is mind blowing coming into a clinic for a facial that's using microdermabrasion and injection therapy for, under an hour and being able to say, well, this isn't just going to help me today to look good for a wedding that I'm going to in a week or two. This is actually going to yield benefits for years into the future because I'm actually giving my body precursors to be able to create connectivity, tightness in my skin, healthier looking skin, new follicles in my head in an approach that's not 20 years ago and 10-year ago technology, but actually well supported by science. It's interesting, before we were talking about clinical indications that was allowable by the Florida bill, and it was, specifically orthopedic injury and topical application. Why? Because we recognize, and the research very much supports the use of exosomes, stem cells, and other regenerative medicine products for regeneration of the skin. I think that we can, look no further than just burn research into using types of acellular as well as cellular products at the ability to regenerate the skin's architecture and laying down fresh skin. We don't treat burn patients. That's not our focus. And I think they should be able to go to someone that is doing those types of specialized procedures. But, being able to understand that the research is there for perhaps the worst circumstances, that we can, in our clinic, be able to do a microdermabrasion or, microneedling and use exosomes and stem cells, muse stem cells topically, and give you a face that you couldn't dream about getting. I mean, what's more exciting than that?
Yeah, no, it's interesting. FDA actually has or exosomes have FDA approval for topical use. So that's really, that's something that's, again, going back to research, going back to ability to use these products. I think it's just a stepping stone for future care. Obviously we live in Miami. There's a ton of med spas. I guess all over the entire country, there's a lot of med spas coming up. What separates STEM's health, from these med spas when it comes to sort of stem cell regenerative procedures?
Yeah, I mean, let's start with med spas don't have doctors in-house. Oftentimes they have a medical director. They pay $20,000 a year to oversee their clinical operations, but they never step in other than to do chart reviews. When you come into our office, you have doctors there. We are overseeing the procedures. If nurse practitioners are doing cosmetic treatments, or you and I are doing stem cell or,
Sure, yeah.
exosome treatments, and we're actually doing the procedure because we want to make sure that they're getting the best possible clinical outcome. When you come into our office, we have protocols that we're following. We're not an aesthetics clinic. We're not trying to push product on someone for Botox or Restylane or fillers or certain types of threading or, get X, Y, and Z done, because look at our menu. We have so many services we can offer. And while you wait, like, buy one of our $20 juices. We're a medical clinic. I mean, we're doctors
We
at the
should have
door.
juices.
We should have juices, but we're doctors at the door. So if you're looking for the best possible medical experience where you're not just doing this for, a freshen up, but you're actually taking it very, very seriously, you want serious people that are doing it, board certified, that have been practicing for combined, 25, 30 years of experience, who have done 20, 30, 40,000 procedures, that are looking at your labs, that are looking at the skin, not just from a how does it look, but actually maybe that redness is lupus, or maybe you have Sjogren's or Sika, or maybe there's some other type of clinical condition that's giving rise to why your skin is like this, rosacea. And there's other treatments that need to be started before, not just, oh yeah, come on in, we'll do a little laser light therapy, and then we'll do some microdermabrasion to you and, sprinkle some pixie dust on top of you to hope for an outcome. If you want the best, it's certainly the short, long way home.
Yeah, so sort of a deeper dermatological dive to make sure we're treating things appropriately. And other sort of clinics and med spas in the area, I think, are they able to offer Dezawa MuseCells or Dezawa Muse exosomes as well?
Well, it's interesting. I don't know specifically what other clinics are offering. I know that the Florida bill that was passed uh, enables only stem cells to be administered by MDs and DOs. So whether or not they're using it outside of their license or they're doing procedures that perhaps aren't using the same concentration of cells, or being able to go deep enough for actually targeting, very deep issues, that's up to their medical director and whether or not they're practicing within their license.
And then so in practice, I mean, a lot of patients that come in, and what kind of questions do you get about hair restoration?
Yeah, the first is, does this work? Does this work? Is it painful? How long will it take for me to see results? How many treatments do I need to get? So, certainly those are the big ones. What I'd venture to say is, you're coming in here because you've done your research. People aren't just, this isn't 1992 where you kind of see something that says stem cell hair restoration and you walk in and say, tell me about it. You've gone through Instagram or TikTok, you've asked Claude or ChatGPT, or you've done independent research and you've really looked at whether or not this is something that works. Then you're showing up in our clinic and saying, okay, I've done all this research in the background. I want you to tell me, because you're a physician, you've practiced, you've been doing these. Does this work? And how does it work? And what's my
Sure.
expected outcome? So I think oftentimes when a patient does show up in our office, they already know that it works. They already know this is something that they want. They want us to reassure them that we know what we're doing, that we're showing them certificates of analysis, that we have the right team in place, and that they're going to get the expected outcome that they already know to be the circumstance that they're going to get.
So I'm at this point in my life, in my hair journey, and I have a lot of friends in their 40s and 50s who are, considering a hair transplant. And obviously, we've gone through the research of let me fly to Turkey, let me fly to Mexico, and then get this done, or should I just do PRP or exosomes or stem cells for my hair? For patients who are kind of on the fence about, should I use regenerative medicine? Should I get a hair transplant? A combination of the two? Like, how do you kind of help those patients guide their decision making?
Yeah, for sure. I mean, listen, I think we can understand that hair transplants pretty much have been defined. They work. They're very expensive. They're quite painful. There's a long recovery period. So if you want to fly to Turkey and take weeks off and shave your head and go through the whole rigmarole of getting a hair transplant, you know the expected outcome. If you're in a place that you're not looking to do that just yet, and almost like surgery, a total knee replacement, a total hair replacement, but you're actually going for something that's minimal recovery period, little to no pain, and you're using something that has demonstrated benefits, then I think that this is a great option for those individuals. If you're totally bald or you have major, major hair loss in areas, you may not get the expected outcome of a hair transplant surgery. But if you're thinning in certain areas and you still have very active follicles in other parts surrounding it, then you're going to notice that your hair starts to thicken, that you have growth of new follicles, and that you actually have a better than expected outcome from that. So it's really patient selection in this circumstance.
How about patients who've had a hair transplant and they're worried about losing their hair from that transplant, or they notice some thinning from it? It's been 10 years and their hair's starting to thin a little bit. Are these regenerative options with Dezawa MuseCells or Dezawa Muse exosomes, are they a good option for these patients post-transplant?
Yeah, I mean, I would say that post-transplant, we don't want to touch them in the immediate period. We don't want to
Sure,
interfere with
about
the
a year's
healing
gone
that's
by or
happening.
2
Yeah,
years.
years have gone by. I think it's a great option for them. I mean, I think this is also kind of like Zen and the art of motorcycle maintenance. It's a bonsai tree. Like, this is not just you did a hair transplant and it should stay forever. You still have, the dihydrotestosterone that's available. You still have male pattern baldness that's still going to happen to you. So maybe you got some, anterior or some sections of your head that had a transplant. There's still other hair that potentially is going to still continue to thin. And so maintaining it and coming in for, hair transplant through stem cells will definitely augment the process of, growing hair back
Absolutely, no, I agree with that. How often do you think patients should come back,
every
for
day.
every single day, just
No,
injections.
I think, certainly, you look in pictures and you can see whether or not you've noticed objectively that your hair is starting to thin. We don't want to convince a patient that you better do it now or it's going to happen. But truly, are you starting to notice these things? And if so, it's better to start it now so it can start growing in before it starts to get worse. Generally speaking, the Muse cells tend to work really, really well up to about 6 months. That doesn't mean they stop working. It just means that perhaps for the next 6 months, they start to slow down in their capacity. So if a patient's indicating that they start noticing thinning from other hair, not that we've treated, but other hair, then they would probably come in another year or two later to get a touch up.